Hello everyone, this is Dr. Tushar Mehta. I'm an orthopedic surgeon, your faculty of orthopedics. I'm sure you all can see this MCQ on your screens right now. Which of the following is false regarding hip dislocation? Primarily, the question is about anterior hip dislocation, posterior hip dislocation. I'll make it simple and clear to all of you. So, guys, first of all, we talk about posterior hip dislocation. It is clinically more common as compared to anterior hip dislocation. That's the first thing. Second thing, in posterior hip dislocation, primarily you will see a car accident, you will see a dashboard injury. Third thing, the entire trauma, let me show you, the entire trauma in a car accident or in a dashboard injury is going to directly hit it onto the patella. So you can have a fracture of the patella as well as a part of the dashboard injury, but here we are not talking about that. The entire force from the dashboard will travel up along the shaft of femur. Now, this force which will travel up along the shaft of femur after a point of time will be like femur. Force will be like femur. Where are you? Femur says, sir, actually inside we have a head and along with the sternum we make hip joint. So force goes inside to the head of the femur and says, hello head, I'm force. Head says, yes, force, how can I help you? It says, come with me. So please understand, this is the point of impact. The force goes up, takes the head from inside posteriorly. So you have understood the fundamental of posterior hip dislocation happening in car accident, happening in dashboard injury. And I'm sure you all can see on your screens right now that the hip is in flexion, adduction, and internal rotation. This is the fundamental of posterior hip dislocation. Now, I have to ask you a very simple question, which is that common nerve that you can expect on this area, sciatic nerve. So, which is the most common nerve injury? Sciatic nerve injury. My next question, which is the common vascular injury that you can expect in this area? No vascular injury. Probably Almighty knew that we're going to sit on our asses for such a long time. So, better not to give an artery to that area. Otherwise, it will be compressed. What will be the most common complication? Avascular necrosis of the head of the femur, to summarize. Posterior hip dislocation, more common than anterior hip dislocation. Car accident, dashboard injury, flexion, adduction, internal rotation, most common nerve injury, sciatic nerve, artery injury, nothing. Most common complication overall, avascular necrosis of the head of the femur. I hope you understand everything. Let's talk about anterior hip dislocation. So posterior hip dislocation is more common. This is less common. First thing. Second thing, posterior hip dislocation is usually due to car accident, dashboard impact. This is usually due to bike accident. So when you're driving a motorbike, usually there are leg guards. Imagine there is no leg guard. So when there is no leg guard, a vehicle from the front comes and directly hits you onto the inner aspect of thigh, due to which your extremity goes into volant abduction and external rotation. So the moment it goes into volant abduction and external rotation, the head of the femur from this area pops out. It pops out. So that leads to anterior hip dislocation. So you can see the attitude of the deformity, flexion, abduction, external rotation, we call it FABR. All right. Most common artery injury, there is one artery here, femoral artery. Most common nerve injury, one nerve here, femoral nerve. Believe me, artery injury is more than nerve injury. Most common complication will remain the same, avascular necrosis of the head of the femur. Now, how can I compare it? I'll tell you. Anterior hip dislocation, posterior hip dislocation, less common, more common. Femoral nerve injury, sciatic nerve injury. Femoral artery injury, no artery injury. Artery injury is more than nerve injury is the only thing that you see. Attitude, flexion, abduction, external rotation. Attitude, flexion, adduction, internal rotation. Most common complication, avascular necrosis of the head. Most common complication, avascular necrosis of the head. I hope you get this thing pretty clear. You can see one more X-ray because I want you to tell me now, since I taught you the entire topic. Now I want you to tell me what is this clinical photograph showing? Number one, what is this clinical photograph showing? Number one. Number two, what is this X-ray showing? So of course it is showing anterior hip dislocation. Even in this X-ray you can see, and even that image you can see flexion, abduction, external rotation. So answer is anterior hip dislocation. So stay tuned for more MCQ discussions like that. I'll tell you one thing today, that to solve an MCQ, you need to have a reflex. You have to have a proper understanding of the concepts of the theory. And that is my motto in all my YouTube videos. I hope you like them and you share and subscribe to my channel. And please ask your friends also to go through these MCQ discussions. They are crucial. Thank you so much.